Hello, everyone. My name is Xavier Grizel, and I'm a third semester senior from the School of Nursing. I'm at the traditional track, and I'd like to share with you a personal story as to why I chose nursing. So in 2008, my wife and I were stationed in Guantanamo Bay, Cuba. She's in the Navy. She's currently a chief in the Navy, and she was pregnant at the time. And unfortunately, in January 2008, my son was born at 31 weeks premature with an underdeveloped lung. The hospital he was born in was the size, about half of the school library right now. It was only 2 stories. And the closest hospital was Jackson Memorial in Miami. They had to call stateside for an airplane to medevac him out, and we had to wait 12 hours for that one. It was a very scary moment at the time. By the way, at that time I was a firefighter in Guantanamo Bay for the Navy as a civilian though, not as a military member. But it was a very scary time for me, and it was just very, very hard, and all I could think about was how awesome the healthcare team was, because it was like death was lingering right over my son. And as I look into the room, I saw life, and at that time I kind of knew, it was going to be okay. So after we moved from Guantanamo Bay and went to San Diego, I pursued firefighting, but something inside me was like, you need to do more, So I went to college there in San Diego for business administration and also my fire protection degree. About 2 years in, I realized this is not what I want to do, So by that time, we were now being stationed in San Antonio. The drive from San Diego to San Antonio is about 24 hours. And I am very cheap, like extremely cheap. I mean, I will drive that 24 hours nonstop because I don't want to pay for an hotel. My wife hates it. So on that drive, during that journey, I was just thinking, man, this would be the perfect opportunity to just start anew. And 2 days after I got here, I decided, you know what? I'm done with firefighting. No disrespect to firefighters or families here. But I decided, I wanted to do more. And it felt like it was just a duty. It was something inside of me burning to do more. So I applied to the nursing programs. But in San Antonio, there's only like 3 or 4 that's really accredited for undergrad in nursing. And UTHSCSA really stood out to me, and I did my prereqs at UTSA, and I got accepted here after 2 years, which is a very competitive program. I think the last class was 90 students got accepted out of possible 550. So it's a very competitive program. And I am very satisfied and happy of my decision that I've made. I've met some awesome people here. And, okay, so I see the sad faces. My son is awesome now. He is, however, a comedian, and he is probably the silliest person I know. Last week, he has asthma, but it's okay, and it's under control. Last week, he had a reaction, and I said to him, take 2 puffs of the red one. And what that means is albuterol is red, and his other steroidal puffs is in a gray, container. So I said, take 2 puffs of the red one. And I saw him going up the stairs like this. And I said, what are you doing? And then he just looked at me. And I said, what are you doing? He says, I thought you said take 2 red popsicles. And this was at 2 a.m. with a crust in his eyes still. And I said, why would I tell you to take 2 red popsicles? I said, take 2 puffs of the red one. And he was like, oh, that's what you said. But with that being said, I think my choice into going to nursing was the right one for me. And intrinsically, it felt very good, to provide that type of care that was provided to me and to pass it on to other families that are really in need. Because as nurses, we are the last line of defense in all the healthcare. We are the one that give the medications, we check the patients, we assess them, we let everybody know what's going on. And it is a great responsibility, and I take it with pride. After graduation in December, I will graduate this December, and I am positive I will go into pediatric nursing. And specifically, I really want to work in the nursery because I want to be like a personal teddy bear to all those to all those babies. I like burping babies. I like changing diapers. I like to feed them. So, it is good. And the staff in the nursing school is very supportive. And one of the things I told my wife was, it's like all my teachers are like my moms and my grandma. No, they're awesome nurses. They nurture you. Like seriously, they really do. They bring us cookies. Today they have, you might hear my accent, I'm from Jamaica. They brought paletas today. And coming from Jamaica, I don't know what a paleta is. So I was like, oh, maybe they have chicken and beef. Because I thought a paleta was similar to like a flauta. So I was like, oh, chicken and beef. And then it's a popsicle. But I had 2 strawberries anyways. But it was the School of Nursing, it's a very, very, very awesome school with awesome staff and awesome people that's currently in there. And, yeah, that's pretty much my journey so far. So thank you guys for listening. And, I think I want to thank you guys also for putting this on because it is an awesome experience to have that interprofessionalism that we really do need, because we do stroll across the campus and I might recognize a face, but I've never stopped to talk to that person and know who that person really is. And as the healthcare team, we need that communication as early as possible. So thank you guys and keep rocking on. So it is Nurses Week. So if you guys could just wear Nurses Rock badges all week, it'll be awesome too.
Hi, I'm Tabatha Higgins. I'm also a senior at the School of Nursing. And like you've heard from many people, I didn't know, well, I knew what I wanted to be when I grew up, but this wasn't it. I always wanted to go to college, and I wanted to study the stars and the planets. I was that nerdy kid at lunchtime when it was indoor recess, and I read about planets. And unfortunately, my parents didn't go to college and didn't have the financial means to send me. So I said, well, I'll go into the Air Force, get the GI Bill, and, maybe I'd be closer to NASA. It's a government organization, right? That would get me in there. And so in 1991, I met my husband, and we got married. And in 1994, we were blessed with 2 beautiful babies who were extremely premature. They were 28 weeks gestation, given only 24 hours to live. And for 3 months straight, we had hours at a time. My daughter did just fine. It's a boy-girl twin. She has a few quirky learning problems, but other than that, she is in college. She's contracted with the Army. She's doing great. My son, he had a grade 4 intraventricular brain hemorrhage when he was 2 days old. So for most people, they don't survive if you are not an infant, and you have your fontanelles to kind of allow for swelling. He also had seizures. He had chronic breathing problems. And so, over the years, he grew into some of his medical and physical disabilities. As a young mom, I was only 23 years old. I had to get out of the Air Force because, somebody needed to be at home. And so I had to learn how to learn how to use a suction machine, give him oxygen, give him round-the-clock nebulizer treatment, sometimes 2 hours at a time, feed him by G-tube, give him IV medications, manage a seizure disorder, later take care of a trach and a ventilator, and give him daily OT and PT, and also be his teacher and his educator. And I also had another baby, and of course, being in the military, my husband was still active duty. We weren't anywhere near family or friends, so I had a huge learning curve. Because when I grew up, it kind of sounds a little crazy, but my parents were like, soap, just put your hands underwater, rub them a little bit, and you're good. Well, you go from that to the learning curve that I went through, and it was a really steep one. So then we had 2 more children after that. And so as our family grew, learning how to manage schedules became very complicated. My husband was deployed a lot, and so it was just me and my little rugrats, and going to appointments, five appointments a week. And somewhere I managed to go grocery shopping and get a little bit of sleep. I didn't get that much sleep, though, because sometimes I'd be doing laundry, and I would take out the dryer sheet and put the whole box in the dryer and be holding the sheet and realizing something was wrong. Wasn't sure what. But finances were always also hard because a lot of the things weren't covered under for our insurance. And so we went to the Social Security office, and their best advice was my husband and I needed to divorce. They said if you just divorced, you wouldn't have his financial means anymore, and you could continue to care for your child without any problem. Well, David said no way, because I probably wouldn't remarry him. So we decided to just stay married and get through it. So in 2009, my son had a surgery that went really bad. It was to save his life. We had a 50-50 shot. After 3 weeks of fighting in the hospital, he had acute respiratory distress syndrome, DIC, multi-organ system failure. What I learned in class, since we've been going, he probably had sepsis. At the time, it wasn't called sepsis. And it took me a long time to find myself, because my life, even though I was a mother of 4, it was very entwined in my son's care. And so that was really difficult for me. And then I decided that, God didn't teach me all of these things to be compassionate and caring and the skills that it takes to do the things that I did if he didn't want me to still continue to use those skills. And frankly, some of the nurses and other medical people I dealt with became like family. They really helped me through some hard times and educated me a lot so that I could take care of my child. So I picked myself up, started my pre-nursing at Northwest Vista, which was kind of crazy because my husband and I have been married 25 years, and probably nobody in my class was 25. So I learned about things like quote sandwiches when I'm trying to write my English paper. I'm like, what is that? And then apparently there really is imaginary numbers. I thought they were just in my checkbook, but apparently they do exist in algebra. So, and then I knew I wanted to go to UTHSCSA. Every doctor that I had ever talked to, every nurse I ever talked to, when I started thinking about nursing, they always said, are you going to UTHSCSA? I mean, it has an amazing reputation. And then I went into our sim lab. And if you haven't been, you've got to check it out. It's really cool. We have these great mannequins that can breathe. They have pulses. They can cry. They can deliver babies. It's kind of scary, though, because if your instructor's in a bad mood, it could be like The Exorcist. I think the head will just start spinning, and I don't know what's going to happen next. But I remember my first day at orientation, and Dr. Bird said that we need to learn a new way of studying. Well, I was like, I got this, right? I mean, I had high A's in Northwest Vista. I'm going to have no trouble until I had my first test. And then I decided, you know what? All these great things that they have for us at our school, like SI sessions and tutoring sessions, those are kind of important. I better take advantage of those. And I learned that it's not about memorization anymore. It's about applying all the things that you learn and you're taught. The program is difficult and demanding, but it's also amazing. I really love our instructors when we're having a hard time with something or just a bad day. They are all nurses at heart, and they're caring, and so they take you under their wing, and they talk to you and help you through. Mr. Ermer likes to tease me because my hair is always going gray if I don't get a chance to get over to get it done, and I'm like, look, this is what the school does to me. It's bad. I have volunteered at the refugee clinic here in San Antonio, which is a student-run clinic, and I really highly recommend everybody look into this clinic. It's amazing. We have people from all over the world come into this clinic, and they really need our help. And we have nurses, we have nursing students, medical students, dental students. They're all collaborating together to help make these people get the best care that we can give. And basically, in closing, I just wanted to say the phrase "it takes a village" is so true when it comes to patient care. A team of physicians, nurses, respiratory therapists, OT, PT, speech, dietary, pharmacy, we all work together. But also remember the family. They're part of the team as well. And they're the ones that are going to help you make sure that your patients are doing what they need and get the help that they need to be able to be compliant and come and get what they need. Every person has a special gift, whether it's the tiniest baby or it's your oldest patient. They all have something to teach you. They all have a story. And if it wasn't for my son, I never would be going into nursing. So when you come across a family member and you just don't think that they'll be able to learn or get it, and you're like, oh gosh, I got to teach them again. Remember, I was only 23 years old. I didn't have any understanding about anything. And now I'm in my senior year at UTHSCSA, and I'm getting ready to be an RN, and I can't wait. So.